Chapter 162 Higher Intellectual Functions. Higher intellectual functions are very essential to make up the human mind. These functions are also called higher brain functions or higher cortical functions. Extensive outer layer of gray matter in cerebral cortex is responsible for higher intellectual functions. Conditioned reflex forms the basis of all higher intellectual functions learning. Definition. Learning is defined as the process by which new information is acquired. It alters the behavior of a person on the basis of past experience. Classification of learning. Learning is classified into two types: non-associative learning, associative learning. Non-associative learning. Non-associative learning involves response of a person to only one type of stimulus. It is based on two factors: habituation, sensitization. Habituation. Habituation means getting used to something, to which a person is constantly exposed. When a person is exposed to a stimulus repeatedly, he starts ignoring the stimulus slowly. During first experience, the event, stimulus, is novel and evokes a response. However, it evokes less response when it is repeated. Finally, the person is habituated to the event, stimulus, and ignores it. Sensitization. Sensitization is a process by which the body is made to become more sensitive to a stimulus. It is called amplification of response. When a stimulus is applied repeatedly, habituation occurs. But, if the same stimulus is combined with another type of stimulus, which may be pleasant or unpleasant, the person becomes more sensitive to original stimulus. For example, a woman is sensitized to crying sound of her baby. She gets habituated to different sounds around her and sleep is not disturbed by these sounds. However, she suddenly wakes up when her baby cries because of sensitization to crying sound of the baby. Thus, sensitization increases the response to an innocuous stimulus when that stimulus is applied after another type of stimulus. Associative learning. Associative learning is a complex process. It involves learning about relations between two or more stimuli at a time. Classic example of associative learning is the conditioned reflex, which is described later in this chapter. Memory. Definition. Memory is defined as the ability to recall past experience or information. It is also defined as retention of learned materials. There are various degrees of memory. Some memories remain only for few seconds, while others last for hours, days, months, or even years together. Anatomical basis of memory. Anatomical basis of memory is the synapse in brain. Synapse for memory coding is slightly different from other synapses. Two separate presynaptic terminals are present here. One of the terminals is primary presynaptic terminal, which ends on postsynaptic neuron as in conventional synapse. This terminal is called sensory terminal, because sensations are transmitted to the postsynaptic neuron through this terminal, Fig 162.1. Other presynaptic terminal ends on the sensory terminal itself. This terminal is called facilitator terminal. When sensory terminal is stimulated alone without facilitator terminal, the firing from sensory terminal leads to habituation, i.e. the firing decreases slowly. On the other hand, if both the terminals are stimulated, facilitation occurs and the signals remain strong for long period, i.e. for few months to few years. Physiological basis of memory. Memory is stored in brain by the alteration of synaptic transmission between the neurons involved in memory. Storage of memory may be facilitated or habituated depending upon many factors, such as neurotransmitter, synaptic transmission, functional status of brain, etc. Facilitation. Facilitation is the process by which memory storage is enhanced. It involves increase in synaptic transmission and increased postsynaptic activity. Often, facilitation is referred as positive memory. The process involved in facilitation of memory is called memory sensitization. Habituation. Habituation is the process by which memory storage is attenuated, Attenuation equals decrease in strength, effect, or value. It involves reduction in synaptic transmission and slow stoppage of postsynaptic activity. Sometimes, habituation is referred as negative memory. Basis for short-term memory. Basic mechanism of memory is the development of new neuronal circuits by the formation of new synapses and facilitation of synaptic transmission. Number of presynaptic terminals and size of the terminals are also increased. This forms the basis of short-term memory. Basis for long-term memory. When neuronal circuit is reinforced by constant activity, memory is consolidated and encoded into different areas of the brain. This encoding makes memory a permanent or a long-term memory. Sites of encoding. Hippocampus and Papez circuit, closed circuit between hippocampus, thalamus, hypothalamus, and corpus striatum, are the main sites of memory encoding, chapter 153. Frontal and parietal areas are also involved in memory storage. Experimental studies of memory, Aphasia. Most of the experimental studies of memory and learning are based on the research carried out in the sea hare, sea snail, called Aphasia. This animal is useful in brain research because it has a simple uncomplicated nervous system that can be easily approached in living animal with simple dissection. Another advantage of the snail is that the individual nerve cells are large and brightly colored. Nobel laureate, Eric Kandel was the pioneer to use Aphasia for the studies of memory and learning. Chemical or molecular basis of memory. Memory engram. Molecular basis of memory can be explained by memory engram. Memory engram is a process by which memory is facilitated and stored in the brain by means of structural and biochemical changes. Often, it is also called memory trace. Molecular basis of facilitation. Molecular mechanism of facilitation is given in figure 162.2. In this process, the neurotransmitter serotonin plays major role. Calcium ions increase the release of serotonin, which facilitates the synaptic transmission to a great extent, leading to memory storage. Molecular basis of habituation. Habituation is due to passive closure of calcium channels of terminal membrane. Hence, the release of transmitter decreases, resulting in decrease in number of action potential in the postsynaptic neuron. So, the signals become weak and weakening of signals leads to habituation. Consolidation of memory. The process by which a short-term memory is crystallized into a long-term memory is called memory consolidation. Consolidation causes permanent facilitation of synapses. It is possible by rehearsal mechanism, i.e. rehearsal of same information again and again accelerates and potentiates the degree of transfer of short-term memory into long-term memory. This is what happens in memorizing a poem or a phrase. Classification of memory. Memory is classified by different methods, on the basis of various factors. Short-term memories and long-term memories. Generally, memory is classified as short-term memory and long-term memory. Short-term memory. Short-term memory is the recalling events that happened very recently, i.e. within hours or days. It is also known as recent memory. For example, telephone number that is known today may be remembered till tomorrow. But if it is not recalled repeatedly, it may be forgotten on the third day. Short-term memory may be interrupted by many factors such as stress, trauma, drug abuse, etc. There is another form of short-term memory called working memory. It is concerned with recollection of past experience for a very short period, on the basis of which an action is executed. Long-term memory. Long-term memory is the recalling of events of weeks, months, years, or sometimes lifetime. It is otherwise called the remote memory. Examples are, recalling first day of schooling, birthday celebration of previous year, picnic enjoyed last week, etc. Long-term memory is more resistant and is not disrupted easily. Explicit and implicit memories. Physiologically, memory is classified into two types, namely explicit memory and implicit memory. Explicit memory is defined as the memory that involves conscious recollection of past experience. It consists of memories regarding events, which occurred in the external world around us. The information stored may be about a particular event that happened at a particular time and place. Explicit memory is otherwise known as declarative memory or recognition memory. Examples of explicit memory are recollection of a birthday party celebrated 3 days ago, events taken place while taking breakfast, etc. Explicit memory involves hippocampus and medial part of temporal lobe. Implicit memory. Implicit memory is defined as the memory in which past experience is utilized without conscious awareness. It helps to perform various skilled activities properly. Implicit memory is otherwise known as non-declarative memory or skilled memory. Examples of implicit memory are cycling, driving, playing tennis, dancing, typing, etc. Implicit memory involves the sensory and motor pathways. Memories depending upon duration. Depending upon duration, memory is classified into 3 types: sensory memory, primary memory, secondary memory. Sensory memory. Sensory memory is the ability to retain sensory signals in sensory areas of brain, for a very short period of few seconds after the actual sensory experience, i.e. few hundred milliseconds. But, the signals are replaced by new sensory signals in less than 1 second. It is the initial stage of memory. It resembles working memory. Primary memory. Primary memory is the memory of facts, words, numbers, letters, or other information retained for few minutes at a time. For example, after searching and finding a telephone number in the directory, we remember the number for a short while. After appreciating beautiful scenery, the details of it could be recalled for some time. Afterwards, it disappears from the memory. Characteristic feature of this type of memory is that the information is available for recall easily from memory store itself. One need not search or squeeze through the mind, but this memory is easily replaced by new bits of memory, i.e. by looking into another telephone number, the first one may disappear. Secondary memory. Secondary memory is the storage of information in brain for a longer period. The information could be recalled after hours, days, months, or years. It is also called fixed memory or permanent memory. It resembles long-term memory. Drugs facilitating memory. Several stimulants for central nervous system are shown to improve learning and memory in animals. Common stimulants are caffeine, physostigmine, amphetamine, nicotine, strychnine, and metrazole. All these substances mentioned above facilitate the consolidation of memory. Applied physiology, abnormalities of memory. Amnesia. Loss of memory is known as amnesia. Amnesia is classified into 2 types: anterograde amnesia, failure to establish new long-term memories. It occurs because of lesion in hippocampus. Retrograde amnesia, failure to recall past remote long-term memory. It occurs in temporal lobe syndrome. Dementia. Dementia is the progressive deterioration of intellect, emotional control, social behavior, and motivation associated with loss of memory. It is an age-related disorder. Usually, it occurs above the age of 65 years. When it occurs under the age of 65, it is called presenile dementia. Causes. Dementia occurs due to many reasons. Most common cause of dementia is Alzheimer disease. In about 75% of cases, dementia is due to this disease, give below. Other common causes of dementia are hydrocephalus, Huntington chorea, Parkinson disease, viral encephalitis, HIV infection, hypothyroidism, hypoparathyroidism, Cushing's syndrome, alcoholic intoxication, poisoning by high dose of barbiturate, carbon monoxide, heavy metals, etc. Clinical features. Common features are loss of recent memory, lack of thinking and judgment, and personality changes. As the disease progresses, psychiatric features begin to appear. Motor functions are also affected. Finally, the patient has to lead a vegetative life without any thinking power. The person is speechless and is unable to understand anything. There is no effective treatment for this disorder. Physostigmine, which inhibits cholinesterase, causes moderate improvement. Alzheimer disease. Alzheimer disease is a progressive neurodegenerative disease. It is due to degeneration, loss of function and death of neurons in many parts of brain, particularly cerebral hemispheres, hippocampus, and pons. There is reduction in the synthesis of most of the neurotransmitters, especially acetylcholine. Synthesis of acetylcholine decreases due to lack of enzyme choline acetyltransferase. Norepinephrine synthesis decreases because of degeneration of locus coeruleus. Dementia is the common feature of this disease. Conditioned reflexes. Definition. Conditioned reflex is the acquired reflex that requires learning, memory and recall of previous experience. It is acquired after birth and it forms the basis of learning. Conditioned reflex is different from unconditioned reflex, Table 162.1. Unconditioned reflex is the inborn reflex, which does not need previous experience. Classification of conditioned reflexes. Conditioned reflexes are classified into two types: classical conditioned reflexes, instrumental conditioned reflexes. Classical conditioned reflexes. Classical conditioned reflexes are those reflexes, which are established by a conditioned stimulus, followed by an unconditioned stimulus. Method of study: Pavlov's bell dog experiments. Various types of classical conditioned reflexes and their properties are demonstrated by the classical bell dog experiments, salivary secretion experiments, done by Ivan Pavlov and his associates. In dogs, the duct of parotid gland or submandibular gland was taken outside through cheek or chin respectively, and the saliva was collected by some special apparatus. Apparatus consisted of a funnel, which is sealed over the opening of the duct. Salivary secretion was measured in drops by means of an electrical recorder. Types and properties of classical conditioned reflexes. Classical conditioned reflexes are classified into two groups according to the properties of reflexes, namely excitation or inhibition, positive or excitatory conditioned reflexes, negative conditioned reflexes. Positive conditioned reflexes, excitation of conditioned reflexes. Types of positive conditioned reflexes: primary conditioned reflex, secondary conditioned reflex, tertiary conditioned reflex. Primary conditioned reflex. Primary conditioned reflex is the reflex developed with one unconditioned stimulus and one conditioned stimulus. This reflex is established in the following way. The animal is fed with food, unconditioned stimulus. Simultaneously a flash of light, conditioned stimulus, is also shown. Both the stimuli are repeated for some days. After the development of reflex, the flash of light, conditioned stimulus, alone causes salivary secretion without food, unconditioned stimulus. Secondary conditioned reflex. Secondary conditioned reflex is the reflex developed with one unconditioned stimulus and two conditioned stimuli. After establishment of a conditioned reflex with one conditioned stimulus, another conditioned stimulus is applied along with the first one. For example, the animal is fed with food, unconditioned reflex, and simultaneously a flash of light, first conditioned stimulus, and a bell sound, second conditioned stimulus, are applied. After development of the reflex, bell sound, second conditioned stimulus, alone can cause salivary secretion, Fig. 162.3. Tertiary conditioned reflex. In this reflex, a third conditioned stimulus is added and the reflex is established. But, the reflex with more than three conditioned stimuli is not possible. Many types of conditioned stimuli associated with sight and hearing were employed by Pavlov. Negative conditioned reflexes, inhibition of conditioned reflexes. The established conditioned reflexes can be inhibited by some factors. The inhibition is of two types: external or indirect inhibition. Internal or direct inhibition. External or indirect inhibition. Established conditioned reflex is inhibited by some form of stimulus, which is quite different from the conditioned stimulus. It is not related to conditioned stimulus. For example, some disturbing factors like sudden entrance of a stranger, sudden noise, or a strong smell can abolish the conditioned reflex and inhibit salivary secretion. This extra stimulus evokes the animal's curiosity and distracts the attention. According to Pavlov, it evokes an investigatory reflex. If the extra, inhibitory, stimulus is repeated for some time, its inhibitory effect gets weakened or abolished. Internal or direct inhibition. There are 4 ways in which the established conditioned reflex is abolished by direct or internal factors, which are related to the conditioned stimulus. Extinction of conditioned reflex. Conditioned inhibition, inhibition by delay or delayed conditioned reflex, differential inhibition. Extinction of conditioned reflex. Extinction is the failure of conditioned reflex. It occurs if an established conditioned reflex is not reinforced by unconditioned stimulus. After establishing a conditioned reflex, the conditioned stimulus must be coupled with unconditioned stimulus now and then, i.e. the conditioned stimulus must be reinforced by unconditioned stimulus. If a conditioned stimulus is given repeatedly several times, without reinforcing it by unconditioned stimulus, there is failure of conditioned reflex. However, the reflex is not abolished if the unconditioned reflex is also used in between. Conditioned inhibition. Conditioned inhibition is the failure of conditioned reflex due to introduction of an unknown, new, conditioned stimulus. When a conditioned stimulus like flash of light is effective, if another conditioned stimulus like a bell sound is applied along with the stimulus suddenly, the response does not occur. Of course, if these 2 conditioned stimuli are given with unconditioned stimulus, food, repeatedly, the secondary conditioned reflex is developed. Inhibition by delay or delayed conditioned reflex. Inhibition by delay is the absence of response or delayed response that occurs while eliciting a conditioned reflex by delaying the unconditioned stimulus. While establishing a conditioned reflex, the conditioned stimulus, light or sound, must be followed by unconditioned stimulus, food, immediately. If the unconditioned stimulus is applied after a long period, response may be absent or delayed. The reflex is called delayed conditioned reflex. Differential inhibition. Differential inhibition is the failure of conditioned reflex that occurs when the conditioned stimulus is altered. When an animal is trained or conditioned for a particular type of conditioned stimulus and if the stimulus is altered even slightly, the response does not occur. The animal is able to discriminate the difference. For example, the alteration in frequency of sound or intensity of light abolishes the conditioned reflex, Table 162.2. Instrumental or operant conditioned reflexes. Instrumental conditioned reflexes are those reflexes in which the behavior of the person is instrumental. This type of reflexes is developed by the conditioned stimulus, followed by a reward or a punishment. The instrumental conditioned reflexes are also called operant conditioned reflexes or Skinner conditioning. During the development of this type of reflexes, the animal is taught to perform some task, in order to obtain a reward or to avoid a punishment. Accordingly, the instrumental conditioned reflexes are of several types, such as, conditioned avoidance reflex, food avoidance reflex, conditioned reward reflex, conditioned avoidance reflex. Conditioned avoidance reflex is the reflex by which the animal is trained to avoid an electric shock, by pressing a bar. Food avoidance conditioning. If an animal is given a tasty food along with injection of a drug, which produces nausea or sickness, the animal starts avoiding or hating that food. It is called food aversion conditioning. Conditioned reward reflex. If the animal is rewarded by a banana by pressing a bar, the animal repeatedly presses the bar. It is the conditioned reward reflex. Instrumental conditioned reflexes play an important role during the learning processes of a child. These conditioned reflexes are also responsible for the behavior pattern of an individual. Physiological basis of conditioned reflexes. Learning and memory form the physiological basis of conditioned reflexes. Speech. Definition. Speech is defined as the expression of thoughts by production of articulate sound, bearing a definite meaning. It is one of the highest functions of brain. When a sound is produced verbally, it is called the speech. If it is expressed by visual symbols, it is known as writing. If visual symbols or written words are expressed verbally, that becomes reading. Mechanism of speech. Speech depends upon coordinated activities of central speech apparatus and peripheral speech apparatus. Central speech apparatus consists of higher centers, i.e. the cortical and subcortical centers. Peripheral speech apparatus includes larynx or sound box, pharynx, mouth, nasal cavities, tongue, and lips. All the structures of peripheral speech apparatus function in coordination with respiratory system, with the influences of motor impulses from respective motor areas of the cerebral cortex. Development of speech. First stage. First stage in the development of speech is the association of certain words with visual, tactile, auditory, and other sensations, aroused by objects in the external world. Association of words with other sensations is stored as memory. Second stage. New neuronal circuits are established during the development of speech. When a definite meaning has been attached to certain words, pathway between the auditory area, Heschl area, area 41, and motor area for the muscles of articulation, which helps in speech, Broca area 44, is established. The child attempts to formulate and pronounce the learned words. Role of cortical areas in the development of speech. Development of speech involves integration of three important areas of cerebral cortex: Wernicke area, Broca area, motor area. Role of Wernicke area: speech understanding. Understanding of speech begins in Wernicke area that is situated in upper part of temporal lobe. It sends fibers to Broca area through a tract called arcuate fasciculus. Wernicke area is responsible for understanding the visual and auditory information required for the production of words. After understanding the words, it sends the information to Broca area. Role of Broca area: speech synthesis. Speech is synthesized in the Broca area. It is situated adjacent to the motor area, responsible for the movements of tongue, lips, and larynx, which are necessary for speech. By receiving information required for production of words from Wernicke area, the Broca area develops the pattern of motor activities required to verbalize the words. The pattern of motor activities is sent to motor area. Role of motor area: activation of peripheral speech apparatus. By receiving the pattern of activities from Broca area, motor area activates the peripheral speech apparatus. It results in initiation of movements of tongue, lips, and larynx required for speech. Later, when the child is taught to read, auditory speech is associated with visual symbols, area 18. Then, there is an association of the auditory and visual areas with the motor area for the muscles of hand. Now, the child is able to express auditory and visual impressions in the form of written words. Nervous control of speech. Speech is an integrated and a well-coordinated motor phenomenon. So, many parts of cortical and subcortical areas are involved in the mechanism of speech. Subcortical areas concerned with speech are controlled by cortical areas of dominant hemisphere. In about 95% of human beings, the left cerebral hemisphere is functionally dominant and those persons are right-handed. Following are the motor and sensory cortical areas concerned with speech. Motor areas. Broca area. Broca area is also called speech center, motor speech area or lower frontal area. It includes areas 44 and 45. These areas are situated in lower part of lateral surface of prefrontal cortex. Broca area controls the movements of structures, tongue, lips, and larynx, involved in vocalization. Upper frontal motor area. Upper frontal motor area is situated in paracentral gyrus over the medial surface of cerebral hemisphere. It controls the coordinated movements involved in writing. Sensory areas. Secondary auditory area. Secondary auditory area or auditopsychic area includes area 22. It is situated in the superior temporal gyrus. It is concerned with the interpretation of auditory sensation and storage of memories of spoken words. Secondary visual area. Secondary visual area or visuopsychic area includes area 18. It is present in angular gyrus of the parietal cortex. This area is concerned with the interpretation of visual sensation and storage of memories of the visual symbols. Wernicke area. Wernicke area is situated in the upper part of temporal lobe. This area is responsible for the interpretation of auditory sensation. It also plays an important role in speech. It is responsible for understanding the auditory information about any word and sending the information to Broca area, Table 162.3. Applied physiology, disorders of speech. Speech disorder is a communication disorder characterized by disrupted speech. It is of 4 types: aphasia, anarthria or dysarthria, dysphonia, stammering. Aphasia. Aphasia is defined as the loss or impairment of speech due to brain damage. In Greek, aphasia equals without speech. It is an acquired disorder and it is distinct from developmental disorders of speech or other speech disorders like dysarthria. Aphasia is not due to paralysis of muscles of articulation. It is due to damage of speech centers. Damage of speech centers impairs the expression and understanding of spoken words. It also affects reading and writing. Speech function is localized to left hemisphere in most of the people. Aphasia may be associated with other speech disorders, which also occur due to brain damage. Causes for aphasia. Usually aphasia occurs due to damage of one or more speech centers, which are situated in cerebral cortex, Table 162.4. Damage of speech centers occurs due to stroke, head injury, severe blow to head, cerebral tumors, brain infections, degenerative diseases. Usually, in conditions like head injury, aphasia occurs suddenly, and in conditions like infections or cerebral tumors, it develops slowly. In children, traumatic aphasia can develop by exposure to a horrifying event, without any brain damage. It may be cured with psychological treatment. Types of aphasia. Aphasia is classified by different methods. The simple and convenient clinical classification divides aphasia into 5 types: Broca aphasia, Wernicke aphasia, global aphasia, nominal aphasia. Other types of aphasia. Broca aphasia. Broca aphasia is the non-fluent speech problem. It occurs due to lesion in left frontal lobe of cerebral cortex. It is also known as expressive aphasia or Anterograde aphasia. The affected persons do not complete the sentences because of their inability to construct the sentences. They often talk in short phrases by omitting small words such as and, is, for, etc. They make great efforts even to initiate speech. Persons with Broca aphasia are able to understand spoken or written words. Often, they are affected by weakness or paralysis of right arm or leg. It is due to damage of frontal lobe, which is also responsible for motor activities. Wernicke aphasia. Wernicke aphasia is the speech without any meaning. It is also called receptive aphasia or posterior aphasia. Wernicke aphasia occurs due lesion in left temporal lobe. It is characterized by fluent speech. The affected persons speak long sentences but without any meaning. They use incorrect or non-existent words and cannot speak sensibly. This type of speech is known as jargon speech. These individuals are unable to understand others' speech. Because of this weakness, they are unaware of their own mistakes while speaking. Often, they are mistaken as psychiatric patients. Wernicke aphasia is not associated with paralysis or weakness of muscles because the injury does not involve the centers concerned with movements. Global aphasia. Global aphasia is the type of aphasia characterized by combined features of Broca aphasia and Wernicke aphasia. It is due to widespread lesion in speech areas caused by infarction of left cerebral hemisphere. It is the most common type of aphasia. The affected persons can neither speak nor understand the spoken words. They cannot read and write also. So they have severe communication problems. Nominal aphasia. Nominal aphasia is the speech disorder characterized by inability in naming the familiar objects. It is also called anomic aphasia or amnesic aphasia. It is due to lesion in posterior temporal and inferior parietal gyri. Other types of aphasia. Motor aphasia. It is the speech disorder caused by the defect in the pathway between left speech areas and excitomotor or precentral cortex, chapter 152. It is also known as verbal aphasia or dyspraxia or apraxia of speech. It is characterized by difficulty in uttering individual words due to lack of coordination between central speech apparatus, higher cortical centers, and peripheral speech apparatus. The affected persons are able to decide what to talk, but they cannot pronounce all the words. They are able to pronounce only few monosyllables such as yes or no. Sensory aphasia. It is the inability to understand words or symbols. It is of two types: auditory aphasia, inability to understand the spoken words. It is also called word deafness. It is due to the lesion in secondary auditory area. Visual aphasia, inability to understand written symbols, difficulty in reading. It is also called word blindness or dyslexia, and it occurs due to the lesion in secondary visual area. Agraphia. Agraphia means inability to write. There is no defect in the muscles of the hand concerned with writing. The subject can read and speak. Agraphia is due to the defect in the connection between the cortical areas concerned with writing. Agraphia differs from dysgraphia, which is characterized by distorted writing or writing incorrect letters. Head's classification of aphasia. Henry Head was the pioneer scientist in the field of speech disorders, and he was the first one to classify aphasia. In 1926, he classified aphasia into 4 types. Head's classification of aphasia is given in Table 162.5. Dysarthria or anarthria. The term dysarthria refers to disturbed articulation. Anarthria means inability to speak. Dysarthria or anarthria is defined as the difficulty or inability to speak because of paralysis or ataxia of muscles involved in articulation. Psychic aspect of speech is not affected. The spoken and written words are understood. Causes of dysarthria. Dysarthria is caused by damage of brain or the nerves that control the muscles involved in speech. It occurs in conditions like stroke, brain injury, degenerative disease like Parkinson's disease and Huntington disease. Dysphonia. Dysphonia is a voice disorder. Often, it is characterized by hoarseness and a sore or a dry throat. Hoarseness means the difficulty in producing sound while trying to speak or a change in the pitch or loudness of voice. The voice may be weak, breathy, scratchy, or husky. Causes of dysphonia. Trauma of vocal cords. Paralysis of vocal cords. Lumps, nodules, on vocal cords. Inflammation of larynx. Hypothyroidism. Stress, psychological dysphonia. Stammering. Stammering or shuddering is a speech disorder characterized by hesitations and involuntary repetitions of certain syllables or words. It is also described as a speech disorder in which normal flow of speech is disturbed by repetitions, prolongations, or abnormal block or stoppage of sound and syllables. It is due to the neurological incoordination of speech, and it is common in children. Stammering is associated with some unusual facial and body movements. Exact cause for stammering is not known. It is thought that stammering may be due to genetic factors, brain damage, neurological disorders or anxiety.